They're becoming more and more common, bacteria that are becoming resistant to antibiotics. Many, like say MRSA, used to be controlled by penicillin, but now that's not necessarily the case. Joining me now is Dr. Vandan Bhide with the Mayo Clinic to talk about this. Doctor, thank you for coming in today. This is almost scary to know that this is happening. MRSA is one of the common ones that we know about. It's been covered in the news, but there's a lot of ailments that this is affecting now.
Right. Well, this is a very serious type of bacteria. And it forms really when a person takes antibiotics. Antibiotics will kill bacteria, sometimes bacteria that we don't want. So sometimes bacteria in our skin or gut. And then there's always a few bacteria that are resistant to whatever antibiotic. It's just natural. And so those bacteria that are naturally resistant to the antibiotic can overgrow. And that's what's happened in the case of MRSA.
Well, let's start with at the level of the person, the patient, before they go to the hospital and see a doctor. What are your options first? Because we know that some medications may not work as well as they used to, like penicillin used to be treated, a lot of them. What are some patient things they can do before they get to the hospital or to the doctor?
I think the most important thing is only use antibiotics when they're necessary. So there's a lot of infections that we get that we think will respond to antibiotics, but they really don't. So we know colds, sore throats, sinus infections, ear infections in kids, especially over the age of 2, those are all either viral infections or they can be treated without antibiotics and people will get better on their own.
So don't use that as your first line of defense.
Right, right. So
if, like, it's cold season, still for some people, I know my kids have one right now, what do you want to do? Just wait it out? Or?
For the most part, if, for example, if your kids continue to have symptoms after 10 to 14 days, or if they have discolored either they're coughing up green stuff or they have green stuff from their nose and it's been 10 to 14 days since their initial cold, then there may be a role for antibiotics. And there you would want to see a doctor and make sure that it's necessary. But in the first couple of days, even if you have green discharge, antibiotics are not going to be helpful, and it's safer to actually wait it out.
So the medical industry has known about this for a while, probably more than we have known about it. What's being done? What are the options when you start to come into these resistant strains?
Well, we call it, especially in the hospital, it's called antibiotic stewardship. So it's really using antibiotics wisely. We often, when people, for example, come in the hospital, people are very, very sick. So sometimes they're started on antibiotics. What we as physicians need to remember is they don't really need that antibiotic, then go ahead and stop it. But really using the right antibiotic for the right infection at the right time is really what's important. And I think physicians and hospitals, we're more aware of that, and we're really trying to do that.
What are some of the things that this is happening for you? We mentioned MRSA. Are there some other majorly known or maybe more minorly known but common ailments that are?
Right. So we have Clostridium difficile, which is a long word. It's a diarrheal infection that people get, especially if they're on antibiotics. Most of the patients who have this type of diarrheal illness, they've been on antibiotics. And so the antibiotics have killed the good bacteria in our gut, including things that would protect us from getting this infection. And so this bad bacteria, which a lot of people have just naturally, will overgrow and cause a very, very serious infection. It can be very serious. People have died of it. And really, it's related to antibiotics.
Any kind of lifestyle changes that are recommended for people who are trying to just improve their health? So maybe as they're getting older in years, don't want this stuff to come on. Is there anything they can be doing now?
Well, I think being as healthy as possible, trying to maintain your immune system by eating healthy, trying to avoid antibiotics in our meats is also very important because
I know, and you see antibiotic-free meats in the store all the time.
Right,
yeah.
And I think that's important because you don't want to get those resistant strains that are in our livestock.
So that stuff can play a role just when you're taking it in other areas of your life.
Any way that you can get the bacteria, and it can be from eating it, you will develop that resistant strain, and then it's very, very hard to treat that.
Dr. Vandan Bhide, thank you for joining us. Very interesting stuff from the Mayo Clinic. We appreciate your time. Well, an estimated 14,000 Americans die from severe diarrhea caused by antibiotics, estimated each year. Other side effects include nausea and vomiting, as well as severe allergic reactions.